Hi everybody, this is Dr. Shea with Align Life Chiropractic and Wellness, and today I want to talk to you specifically about a condition that is actually really common in our population, but I don't think people have really understood it, or more importantly, understood what they can actually do about it to be able to help them. And this condition is called a Dowagers Hump. There are other names for it, like thoracic hyperkyphosis or anterior head carriage associated with upper thoracic kyphosis. All of these names are used to describe a condition in which the upper back has become excessively rounded and the head has then shifted forward in this direction. So today I want to talk to you about who this condition impacts. I want to talk about the consequences associated with this issue. I want to talk about when it happens for people. And most importantly, I'd like to talk about some treatment options that Align Life Chiropractic and Wellness uniquely provides for our population. So let's get started. So first off, how do you know if you have thoracic hyperkyphosis or Dowagers Hump? One of the best ways for us to diagnose this issue is actually to look at an x-ray of the upper back when viewed from the side, okay? The normal curve in the upper back is about 40 degrees. Now, an abnormal curve can be 50 degrees or 60 or sometimes 70, 80, or 90 degrees, just depending upon the severity of the condition. So again, this is only found on an x-ray. This condition primarily affects people who are either in their teenage years all the way up in through their geriatric years, and actually it's most common in the people who are age 55 and older. That being said, there is commonly a genetic predisposition to this, meaning if your parents have it or your grandparents have this condition, then it is more common that your body will express the same thing. And I see this clinically all the time in the office where a family member will come in and their body position habits and their behaviors will trickle down, if you will, into the lower generation, and the next generation, like the child or the grandchild, will also express a similar postural fault. There are four main reasons why people begin to express a Dowagers Hump. The first is just having poor postural habits. These days, we spend more time looking down at our cell phones and down at our laptops and down at our television screens than ever before. And just having this quantity of time spent in a forward flex position can be enough to cause upper back rounding and forward head posture appearance. The second thing that we see is in our juvenile population, we'll see something called Scheuermann's kyphosis, or in a more of a disease process oriented condition, we'll see something called Cushing's syndrome. Cushing's essentially is associated with long-term corticosteroid use, where we get this moon face, maybe a little bit of swelling and so forth, and oftentimes we'll get this excessive fat pad that'll actually take place in the upper back. The last reason is because of what's called a compression fracture. So the load-bearing part of the spine, called the vertebral body, actually compresses because of excessive load. Oftentimes this is due to a trauma. So I have a lot of military people, they've jumped out of airplanes, they have a hard landing on the ground, and accordingly the spine literally crumples a bit at that individual segment. We'll also see people who have osteoporosis, which causes brittle bones or bones that are more predisposed to breaking and cracking. The vertebral body height is smushed in the front, and accordingly we get this, again, upper back rounding position. The consequences of these problems is that we'll get a lot more upper back pain and stiffness. We'll get a lot more neck pain and stiffness. We see a lot of these individuals with headaches and migraines that are chronic. We'll even getting symptoms that'll come down the arms. Remember, the nerves that leave the neck go upward into the head, face, sinuses, jaws, ears, and eyes. We'll also see that the nerve roots that leave the base of the neck come down the arms. So pain is common, but also numbness, tingling, burning, weakness, and coldness. These are all symptoms that are very, very common associated with a Dowagers Hump. Besides just the more cosmetic concern associated with this position, especially because as a person goes through time, gravity has more and more leverage over the structure. It's constantly pushing down. So the more the head comes out here in the front and the upper back rounds, the faster that this process will actually speed up. That is one of the main concerns, is this concept of progression. So in order for us to be able to stop the progression of this and actually get this turned around if possible and potentially improve the person's postural position and then accordingly their underlying symptoms, I want to talk to you now a little bit about what Align Life Chiropractic and Wellness does in order to be able to help with this type of issue. Unlike traditional chiropractic approaches to thoracic hyperkyphosis, which primarily is just about chiropractic adjustments, Align Life Chiropractic and Wellness provides the adjustment, but then we go multiple steps deeper into this process. The first part that we do is we actually want to look at the patient's home and work environments to be able to look if there are any postural positions that they're doing regularly that may contribute to the problem in the first place. Most commonly, this is associated with their desk setup. Many times these are individuals that have seated jobs in front of a computer. So the first thing we want to do is we want to get pictures of their body in relationship to their workspace. And we want to analyze that from an ergonomic perspective to be able to get them very specific solutions to be able to keep their body and posture in an upright position. The next thing we do is we provide postural-based exercises. These are specific to the individual. They're based upon postural photos and analysis of that, and x-rays and analysis of that. So we put that together, and then we provide a progressively more and more challenging exercise regimen to be able to help the person gain more and more strength and flexibility through the upper back, flexibility in through the chest, and the deep neck flexors to be able to help pull the position into a more upright posture. The last element of this that's really unique to what we do here at Aligned Life is we provide three-dimensional full spine traction. Traction is actually how we change the shape of the underlying structural problem. So I always think of this very similar to the concept of braces for teeth, in that when an orthodontist sees that a teeth set are crooked, then they apply braces by pushing into a certain direction over a period of time. This ultimately allows the teeth to become further aligned and improve the function of them. Similarly, in our office, we provide three-dimensional full spine traction to push in certain directions. In this case, we want to take a flexed upper back and we want to open the upper back into a more extended position. We also want to take the head and add more curve into it and bring it back so that we can see the whole of the ear lining midline up with the shoulder as much as possible. Now, depending upon the severity of the condition and the length of time that it's been going on, it may not be that we can make a full correction. However, being able to make even small changes in this respect can provide substantial symptom and function improvements, and that's definitely worth it for our people. To understand this at a deep level, one analysis that we keep seeing in the literature is this concept of sagittal balance. Sagittal balance describes when you look at an individual from the side view, we should see that the whole of the ear line up with the midline of the shoulder, the middle of the hip, the knee, and the ankle bone. It's one straight line. And what we can tell by this is if we put an angle or a line onto an x-ray without knowing anything else about the individual, we can, with a very high degree of sensitivity, determine if that person in the future will have chronic pain or will be dependent upon other individuals to provide them help with their activities of daily living. If we can keep their body on the plumb line, which is the sagittal balance line, then their likelihood of chronic pain goes way down. Their likelihood of independence goes way up. If we have lots of angles and measurements, which is super common with this type of presentation, then that individual is going to be in more pain and they're going to need more help in the future. So if you'd like to avoid these types of issues, and more importantly, maybe have an initial evaluation to understand where your body is at the moment, we would love to help you here at Align Life Chiropractic and Wellness, and we provide an initial consultation, postural photos, exam, and x-rays in order to be able to give you a proper analysis and determine the appropriate next steps. So if this is something that relates to you and that you're interested in, we would love to work with you here at Align Life. I hope this has been helpful for you guys. If you have any questions, please reach out to us, alignedlifewellness.com. Please also consider liking and subscribing to our page if you feel like this was helpful for you to understand this condition. Thanks so much and have a great day.